Time now for Wellness Wednesday. Hearing loss impacts not only your health, but your quality of life as well. It can lead to isolation socially, depression, and cognitive decline. Audiology Awareness Month shines a spotlight on getting the help you need. And we have Dr. Andrea Gomert with us this morning with UT Health East Texas and UT Tyler. Dr. Gomert, thanks for being with us.
Thank you so much for having me.
So how common is hearing loss?
Well, hearing loss is very common. It affects approximately 1.5 billion people across worldwide. And in the United States, it's estimated that at least 1 in 8 adults experiences hearing loss. I think what's troubling about that number worldwide or in the United States is most people wait an average of 7 years before actually seeking help for their hearing loss.
So what are the risks of leaving that hearing loss untreated?
Yeah, untreated hearing loss has a lot of risk. One of them is cognitive decline, and then social isolation, depression, and even there are causative factors and risk for dementia. Because it affects not only your ability to communicate with family and friends, but it also affects brain health and emotional well-being. For older adults, it's linked even also to a higher risk for falls because our ears are playing an important role in maintaining our balance as well.
So you talked about older adults. Is this also a concern for children as well?
True. Yes, children are affected by hearing loss as well. And in fact, approximately 3 out of every 1,000 infants is actually born with hearing loss. And then 1 in 5 children in the United States will experience hearing loss by the age of 18. For children, when we have untreated hearing loss, it can lead to speech and language delays or development. It also hinders their academic performance in schools. Of course, it can affect their social and emotional growth. And then they may struggle to form relationships, experience low self-esteem, depression, and face lifelong challenges in learning and communication.
What causes that hearing loss in children, though?
There can be many factors. One of them is just congenital hearing loss, family history of hearing loss. It can be acquired, though, over time or progressive. Many genetic factors play a part in hearing loss with children born with it, but then there are infections that can happen, trauma to the ears, and then definitely noise exposure. Some children actually will pass that newborn hearing screening at birth, but then develop hearing loss later, which is why ongoing monitoring or checking in on hearing is essential.
So I'm sure that can be a little scary for parents. So what should families do to protect their children's hearing?
I think parents are the best reporters. When there's a concern by a parent that their child may not be hearing, I would say seek help immediately. Reach out to your pediatrician and tell them you have some concerns, because there is no such age as too young to test hearing. Intervention can begin at birth and shortly after, and having early intervention for hearing loss, discovering it can lead to early medical treatment or intervention with hearing aids or cochlear implants that will help children thrive.
Getting on it early, very, very important. All right, let's go back a little bit and talk a little bit about older adults. What do we know right now about the connection between hearing loss and dementia?
Yes, in 2023, there was a very large report from the Lancet Commission that studied from Johns Hopkins University. And they found that there was a link between hearing loss, untreated hearing loss, and dementia. It was said that adults with moderate to severe hearing loss were 60% more likely to develop dementia when they were compared with normal hearing people. And another study from NIH found recently that dementia can be slowed some with interventions such as addressing the hearing loss and having hearing aids applied.
So how does that untreated hearing loss impact the brain over time?
Well, I like to tell my patients, and this is a very simple demonstration, but basically, if you want to think about the ears are kind of the doors to the brain. We don't realize it, but our ears are always on. We're hearing the air conditioner, we're hearing the microwave go off, we hear the turn signal on our car, even if we're not attending to it. But what happens over time is hearing loss will take away those sounds, those constant stimulation. And I like to think of the ears start closing the door. And when that happens, the parts of the brain that are responsible for auditory processing will actually start saying, well, nothing's going on here, and they start shutting down. And so I like to think of it as you use it or you lose it.
That is a really good analogy to explain that to people. So let's talk about hearing loss being considered as an early warning sign. Is it a contributing factor or an early warning sign for cognitive decline, or both?
At this point, they consider it an early warning sign. There's a lot of research being done in this area, and I will let you know that most NIH is recommending people begin to address hearing loss as soon as possible, and they are seeing, whether treating it early can slow it down. I don't think we've reached that point yet. They do have one study that has shown a decline by nearly 50% in high-risk adults over 3 years, but these are usually longitudinal studies they have to do. But I think I want to say something about that. It's not just the cognitive decline, but social interaction as well, that you want to keep them socially active.
That social isolation can play a big part in all of this, right?
Correct. I always think the same thing happens as far as with the brain. If you've stopped interacting with family and friends because you can't hear at a dinner party or a family gathering, there's less stimulation, not just in the auditory area, but really in the cognitive areas where you're formulating responses to conversation. And so the more isolated you are, just because you can't receive not only environmental sounds, but communication with family and friends, the more shut down you become. And again, that brain, those doors are just closing because there's no interaction.
I feel like as you get older, or maybe, just as we all get older, we're all doing that, right? There is a bit of a stigma attached with saying, hey, something's going on here. I'm not hearing as good as I used to, because you don't want to I don't want to admit, you're getting older and all of those things. But is it really important to address that hearing loss and get hearing aids if you need them?
Yes, and I think one of the things I want the viewers to understand, many people don't know that hearing tests are covered by every payer. Medicare will pay for a hearing test, Medicaid, all insurance companies, and that's for all ages. So first of all, financial barriers should not be an issue. If you think your hearing is suffering, go ahead and be evaluated as quickly as possible. Have your hearing evaluated. And then if you need hearing aids, they're so much different. Many people, I tell my patients, I've worn hearing aids, well, honestly, since 7th grade. And they're so much different as time has gone by. And I tell people that, the stigma, I believe you look older when you can't interact with people, okay? So if you go to a party and you're not talking to people, they either assume maybe you are having dementia or you just don't interact anymore versus interacting because you wear hearing aids. And I think in our current environment that we have now, even with little children, it's not the stigma that it once used to be. And so I would say, yes, go ahead and seek out hearing aids or whatever it may need to be to keep you active with your friends and family and to keep that brain functioning.
Are hearing aids the only option, or are there other interventions that can also help?
There are other interventions. Many times patients, because of the degree of hearing loss, might need to get cochlear implants, and that's actually a surgery. But audiologists are aware of when you need to seek that out. That's an option for some people. There's also other assistive devices. Sometimes we find that patients maybe they don't need a hearing aid, but they need some sort of device they can wear. Hearables has become something new in the environment. Many people are aware that AirPods now can be modified to be hearing aids. So that could be for someone who just needs help at a business meeting. We have remote microphones, so there's a lot of technology. And then sometimes we also have therapy that's called oral rehabilitation therapy, where we do a lot of listening exercises with patients, helping them listen in background noise and things like that.
Is there anything that you would say that we need to be doing to protect our hearing? We used to hear as kids when we were younger, don't listen to that music too loud. But now, like you mentioned, people have AirPods in their ears a lot of times, or they have headphones on. What should we be doing to protect our hearing?
Yes. First of all, I tell parents, if you can hear your child's AirPods, then they're too loud. That's an automatic. So if people around you can hear your music, they're too loud. But as far as protecting our hearing, my students, I tell them there's actually apps you can put on your phone that are free sound level meter apps. But if you go to an environment and things are very loud, I would say for concerts, you need to get those hearing protection. They're simple earplugs that you could buy at the drugstore. They're yellow. You squish them up and put them in your ear. If you go to a lot of events that are racing or concerts and things, there's also cute headphones now that you can wear. Most patients don't realize even that some of their hobbies are very loud, like hunting. You need to wear hearing protection for that. Or if you do a lot of woodworking, carpentry, you need to have either earplugs in your ears or headphones on to protect from noise. And sometimes even just mowing the lawn. We have a lot of people in East Texas who have large land and they have a lot of equipment on there. Wearing hearing protection during that. You want to keep what you have and protect when you're in a noisy environment so that you don't cause ongoing hearing loss.
Is there a magic age that we should start getting our hearing checked again, if in fact we didn't suffer hearing loss as a child, but it feels like it's coming on later?
It's fun. So the NIH is about to recommend that everyone start getting their hearing tested or at age 50. But I would like to say hearing loss affects everyone in their 20s or, wherever. So if you ever are concerned that you feel like there's been a change in your hearing, again, seek out that help from an audiologist. Again, it's covered by insurance or payers, and have your hearing tested. But the age they're starting to recommend is that age 50 people start having a hearing evaluation to check for that hearing loss.
Such good advice. Thank you so much, Dr. Gomert, for being with us today and enlightening us about all the ways that we can protect our hearing.
All right. Thank you so much.
And you can learn more about audiology referrals and see the full interview online and streaming on CBS 19+.